Hello, my name is Elizabeth Posen, and today I will be presenting my research on vocal fold cysts in singers. So, a vocal fold cyst is defined as a fluid or mucus filled sac that rests on the vocal folds. You can see it in the image right here. It's that little bubble that rests on the vocal folds. Having a singular mass on the vocal folds can lead to asymmetry and a decreased ability to close the vocal folds during phonation or speaking. Now, should this injury happen in a singer, it can severely damage their voice and affect their vocal career. So, therefore, the purpose of this research is going to be identifying symptoms, causes, and cures of vocal fold cysts. And this will help educate singers in case they are diagnosed with this specific vocal fold pathology. So, first, I'm going to start with symptoms, which are as follows. We have voice hoarseness, painful phonation, frequent coughing, and a breathy tone. Causes for a vocal fold cyst are usually biological, such as a clogged duct on the vocal folds. It can form into two different subtypes. We have epidermoid cysts and mucus retention cysts. Epidermoid cysts usually occur when keratin or skin tissue is trapped in the vocal folds, while mucus retention cysts occur as the result of a gland being trapped on the vocal folds. Now, typically, epidermoid cysts are more serious in nature because keratin is more solid than mucus. Cysts can also be exacerbated by vocal misuse and lifestyle factors. So, examples are poor nutrition, fatigue, and vocal misuse. So, that could be singing too much or singing with improper techniques such as belting incorrectly, or if you're singing in a loud environment. And lastly, I have researched cures for vocal fold cysts. Vocal rest is typically used first as a natural treatment, so that's not talking at all to try and reduce the tension. Behavioral therapy, otherwise known as voice therapy, can also be provided by a speech and language pathologist, abbreviated as SLP. A singer can partake in a series of exercises to help reduce dysphonia, like humming or singing on a fricative. This is referred to as the semi occluded vocal tract, or SOVT. However, most cases of vocal fold cysts will require surgery. This is because a cyst will form biologically, and voice therapy is most effective when there is a mechanical or technical cause for the vocal fold pathology. The academic literature will recommend 2 to 6 weeks of post-operative recovery due to the presence of scar tissue, which can decrease dexterity in the vocal folds and lead to an effect on the phonation. In terms of further questions, I would like to do more research into non-invasive treatments. There are a lot of negative post-surgical side effects. Along with the scar tissue that I mentioned previously, there's also a risk of infection that can occur with any operation. Most vocal fold pathologies can be treated entirely without surgery in the first place, and I hope that the same can occur with vocal fold cysts. Thank you for watching, and I'm happy to answer any questions that you have.